Welcome to episode 23. Today, we're going to dive into a topic that's often really misunderstood, and that is bioidentical hormones versus conventional hormone therapy. So, you've probably heard the term bioidentical thrown around a lot, but what does it actually mean? And more importantly, how do we choose the best option for each individual person, for you? That's exactly what we're going to break down today. I'm going to define some misconceptions around bioidentical hormones. I'm going to explain why bioidentical doesn't always mean what you think it does, and how to know the difference, and how to make informed choices that are best for you. So let's go. You're listening to the Beyond the Thyroid podcast. I'm your host, Dr. Dana Gibbs. I'm an ENT surgeon and hormone specialist. For years, I struggled with my own unrecognized thyroid problems before and even after I was regularly performing thyroid surgeries. Then, one day, I learned something that turned my health around and opened my eyes to the limits of mainstream medicine in treating more subtle thyroid abnormalities. I spent the next 20 years fine-tuning my hormone expertise in disorders like Hashimoto's disease, perimenopause, and stress-related illness. Come join me as I share this new approach to hormones that empowers you to take control of your own thyroid and hormone imbalances. Let's dive in. I have a really exciting announcement. Because up to 50% of people who suffer symptoms of low thyroid, the low energy, the weight gain, the gut problems, the thin hair, dry skin, will be told by multiple providers that there's nothing wrong with their thyroid before they get a diagnosis because they have normal TSH, I am going to build a new offering in my practice that I'm going to call the Thyroid Checkup. Because this circumstance is so discouraging and frustrating when you know you don't feel like your normal self. I know because it happened to me and hundreds of my clients. So if that's you, what you need is access to advanced thyroid lab testing and analysis by an experienced and qualified specialist who goes beyond guidelines-based thyroid care to help you finally know where you actually stand in regards to your thyroid. This will be a small group program with direct access to me, where I'll help each person get answers about their thyroid status and next steps to recover their energy and vitality. So if you want more info about this, go to www.danagibbsmd.com/checkup to get the earliest notification when I open this program. It's going to be soon, so don't wait. All right. Hello, my friend, and welcome back. If you're new here, welcome to you. You may be surprised to hear me talking about something that's only indirectly related to thyroid problems today, and that is bioidentical hormones for menopause. So if you're curious about this same topic in regards to thyroid hormones, I would suggest that you take a listen to episodes 13 and 14 after this one, where I go into lots of details about the different ways that we can supplement or replace thyroid hormones if that is necessary. So this is a question and a blanket statement that comes up really frequently when people are coming in to work with me. And that is, I don't want to take any drugs. And by this, they mean prescription, commercially available, FDA approved products. And I get it. Our medical system has gotten a reputation for a drug for every symptom and not actually digging into why someone is not feeling well and taking care of that. Well, that's what I do all day, every day. I work on identifying and reversing the underlying cause of whatever's keeping you from feeling not your best self. And what I find frequently is that it's a hormone imbalance or even a deficiency that's not going to completely reverse with lifestyle changes. Other times I find a temporary condition that's where the best way to resolve it quickly is by temporary rebalancing of hormones, where we can increase energy so that you can begin exercising or focus on healthier eating, or what other condition is holding you back. So, what I'm going to talk about today is my philosophy of using hormones versus drugs and versus supplements, which and what those all mean. So, what I want to go over is how bioidentical hormones can be natural or synthetic, why comparing synthetic and non bioidentical hormones like chemical drugs is like comparing apples and oranges, when I feel like compounded options may be necessary, and why the route of administration really matters. So, you've probably heard the term bioidentical thrown around a lot, but what does it actually mean? And more importantly, is a bioidentical product the best option for you? So, that's what I want to break down. And what does conventional hormone therapy even mean? So, for the last 20 plus years, and even today, conventional therapy for most women means no hormone therapy, conventional treatment. We've heard things for the last 20 years like hormones cause cancer, or no, I won't prescribe that for you. These statements are rooted really in fear and misinformation. The truth is, modern menopausal hormone therapy is really safe, it's effective, and it's substantially without the negative side effects of older methods that were popular years ago. So there's a lot of confusion about what makes a hormone natural or synthetic. And many people assume that bioidentical means something that's completely natural and it's mixed up in a compounding pharmacy, but that is not always true. So I'm going to explain to you what bioidentical hormones really are and how they compare to the more conventional options, and then when compounded formulations make sense. So by the end of this episode, you hopefully will be able to make an informed decision about what's best for your own health. All right, so let's clear up what bioidentical actually means. Many people assume it refers to something natural or something that's custom made in a compounding pharmacy, but the real definition is very simple. A bioidentical hormone is one that is chemically and biochemically identical to what the human body naturally produces. So I'm going to use an example. I'm going to use estradiol. That is the primary estrogen in human physiology. And it can be synthesized from yams or soy, but at the molecular level, it is identical to the estradiol your ovaries produce. This means it binds to your hormone receptors and functions exactly the same way in your body. On the other hand, just because something is natural doesn't mean it's bioidentical. Take Premarin, for example, and this is the more conventional hormone replacement therapy that's been used for about 50 years now. So Premarin is derived from pregnant mare's urine. So technically it's natural, but the estrogens that it contains are primarily horse estrogens, and they are not found naturally in the human body. That is why Premarin is considered a drug. And to me, it's not a bioidentical hormone. Another example would be ethinyl estradiol, ethinyl estradiol. This is the estrogen like drug that's in most birth control pills. This is a synthesized drug, not a hormone, because it is not biologically identical to any natural hormone in our bodies. It is somewhat similar to estrogen. It has strong estrogen effects, but it also suppresses many natural hormone functions, which is why it's used in contraception. So the key takeaway here is that bioidentical means structurally identical to human hormones, whether it's made in a lab, extracted from a natural source, or comes from somewhere else. So it's the molecule that matters, not really where it comes from. So let's understand the different types of hormones that are available for menopausal hormone replacement. Estradiol, FDA approved bioidentical estradiol, is the gold standard currently for estrogen replacement. There are things called biest and triest. These are compounded bioidenticals that include estradiol, estriol, and estrone. Now, let's talk about these other compounds because they are naturally found in the human body as breakdown products of estradiol. So estriol is weaker and requires higher doses that can lead to unintended effects. Now, this is not generally a natural compound. It is made in a lab, and then compounding pharmacies mix it in with estradiol to give different effects that we'll talk about in a minute. Estrone is a breakdown product of estradiol, and estrone alone is not used for any clinical indication. It has no proven benefit over estradiol and may actually increase cancer risk, especially at higher levels. When you take something that has estrone in it, it can actually bind and interfere with the effect of the estradiol, the positive effects that we want of the estradiol. Estriol, although it does not seem to be harmful that we can tell, it is also weaker and interferes with the binding and use of estradiol in your system, which can lead to some unintended effects. So here's another one. So this is a drug. It's called Premarin basedoxifene. So this is a combination of natural conjugated estrogens from a horse and a SERM, a selective estrogen receptor modulator called basedoxifene. And this is a pretty useful medication for somebody who cannot take progesterone because the SERM, the basedoxifene that's in there, blocks the proliferative effects of the estrogens, which can lead to uterine lining thickening and possibly uterine cancer. So, because it does this, it seems to be safer for somebody who can't take progesterone or possibly even somebody who is on an estrogen receptor blocker because of cancer or some other thing. So that can be a good option for some specific women, but it is not considered bioidentical in any way. First of all, natural, the first product, natural, but not bioidentical. Second, a drug that is synthetic, also not bioidentical. So these distinctions are important because choosing the right form of estrogen for yourself, bioidentical or not, can influence everything from symptom relief to long-term health outcomes. So now, what about compounded bioidentical hormones? Some people prefer them over FDA-approved versions, but it's important to understand why you're taking that if you're going to take that, because the hormones that are in compounded bioidentical hormones are the same base ingredient that is bought and put into the FDA approved versions of estradiol and estriol and progesterone and even testosterone. They're the same. They're probably even made by the same bulk manufacturer. So, why would you choose a compounded bioidentical over an FDA approved bioidentical when the compounded has a chance of having significant variations in quality control if you are not completely sure of the lab that you're getting that from? So, I personally consider compounded bioidenticals a second choice rather than a first line option. Why? Because while they can be helpful in certain situations, they are not subject to the same rigorous quality and quantity testing as an FDA approved product. They can vary in potency, in purity, in effectiveness, which means you don't always know if you're getting the same dose every time or how it's even working in your body. So, that being said, there are cases where compounded bioidenticals are actually better than an FDA approved version, such as when the FDA approved version doesn't exist in the form that you need. The biggest example of this is going to be testosterone for women. There is no FDA approved testosterone option for women currently available on the market. So Many women who need testosterone have to rely on a compounded formulation or take something that is not FDA approved for their personal indication. Now, that is done, and it is possible to do that, but a lot of times your insurance company is going to use that as an excuse not to cover that for you. Also, let's talk for a second about what it means to have an FDA approved indication. So, testosterone, now I'm just going to pick on that again. Testosterone in women is known to help them build muscle. It is known to improve your mood and your energy. But the only FDA approved recognized indication for testosterone is low sexual desire. This seems very patriarchal to me. It's like, okay, well, if it inconveniences the men, maybe we'll let the women have testosterone. But that said, there is still no formulation in the US anyway that's available for a woman to take, because a woman needs about a tenth as much testosterone as a standard man's dose. And it can go down from there to like a 20th even. So a compounded bioidentical would be pretty useful in that situation. Another reason to consider compounding is if a patient has an allergy or sensitivity to the inactive ingredients that are in commercial products. In general, if a bioidentical hormone is available in an FDA approved, I prefer that route because of the consistency, safety, and quality control. But say, for example, if you need progesterone and you are allergic to peanut oil, most progesterone tablets, they're kind of gel caps actually, are dissolved. The progesterone is dissolved in peanut oil. And if you have a bad peanut sensitivity, you may not be able to take that. And so you might prefer a capsule with a different kind of excipient, a different kind of inactive ingredient in your capsule of progesterone than what you could get by taking the FDA approved commercial product that's available. So that brings up another point in hormone therapy, because it's really, really key how you take the hormone. The route of administration really matters. So, for example, if you take oral estrogens, whether it's Premarin or whether it's estradiol, you swallow it, it goes into your stomach, and then it goes through your bloodstream, through your liver first before it goes out into your body tissues, which increases the conversion to estrone, which is a chemical that it has known side effects like blood clot risk. Also, the estrone, as we talked about before, goes to the estrogen receptor and kind of blocks it, so that you need higher levels of estradiol in order to overcome the excess estrone that's hanging around because it went to your liver first. So if you use a patch or a gel or a cream, so you're getting transdermal absorption of that hormone, you avoid that first pass metabolism, making it a much safer delivery method and enabling you to take a much lower dose and get the good effects from that. There is also vaginal administration, which provides direct absorption into the bloodstream around the vaginal area without liver metabolism first. Or supposedly, and I don't personally use these, but you can also do this sublingually, where you put some liquid hormone in your mouth and it absorbs into the blood supply around your mouth without being swallowed. My feeling about this is that you kind of can't help swallowing some of it if you're putting it sublingually. So I have not used a sublingual formulation, but maybe there's some reason why that would be helpful. But this is why I generally recommend a transdermal or vaginal option over oral estrogens whenever possible. So let's talk a little bit about hormone receptor positive cancers. So many women with hormone receptor positive cancers are told that they cannot use any form of estrogen and that they have to stay on either an estrogen receptor blocker or an estrogen conversion blocker. So that is what the standard therapy for hormone receptor positive cancers is, and it's very effective. It works really, really well to reduce the risk of recurrence, which can go on. That recurrence risk can keep on going for 20 years after you've had that receptor positive cancer and been cured from it. And so it's not always the case that those folks cannot use any form of estrogen. So vaginal estrogen preparations like estradiol rings, creams, and tablets that you apply directly to the vaginal tissue have minimal systemic absorption, making them safe for many women and even those with that history of breast cancer. And you can do that even while you're on the treatment for the breast cancer. There is also progesterone, and progesterone is a bioidentical version of something called DHEA, dihydroepiandrosterone. This is a precursor to both testosterone and estradiol. And DHEA can be taken orally, which does result in that first pass metabolism. And that's not available as a prescription. That's a supplement. And so it's not controlled. But there is also an FDA approved vaginal insert that can be used. And it really helps with vaginal dryness and discomfort and urinary tract infections and sexual pleasure without increasing systemic estrogen levels. It works because it's locally converting to small amounts of testosterone and estrogen within the local tissues. And so that makes it a great alternative for some women who are either completely unable or who are worried about taking a systemic estrogen. And this could be a real game changer for those folks. So, my personal approach to hormone therapy for my patients, because this is something that I do in my practice, I'm not just a thyroid doctor. I do hormone management of lots of different kinds of hormones. So, I do prioritize the least amount of the right hormone to get the desired effect. I use FDA approved bioidentical hormone whenever possible because there's the highest standards for consistency and for safety and independent third-party testing that has been done to prove that there's not something that shouldn't be in there. I have definite opinions on which brands and manufacturers I want to use for any given hormone product that I recommend because there are actually major differences in potency and quality between the brands. And just like you might have heard before that Synthroid is really better than most of the generic versions of levothyroxine, this is also true for most of the other hormones that I recommend, particularly with the topical vaginal estradiol preparations. There are some manufacturers that use different excipients, different carrier creams and gels and whatever that cause allergic reactions. And so if you have that, then you got to go to something else because that is going to remove all of the good benefits of taking a vaginal estradiol. So if your FDA approved version isn't available or isn't tolerated, then I would consider compounded options. And when neither of those is an option, we may explore some alternative strategies. But I also always want to make sure those approaches are at least supported by evidence and proven not to be harmful. All right, so what's the bottom line here? Bioidentical means biochemically and biologically identical to human hormones, not just natural. And they can be synthetic. Sometimes the synthetic option is actually the better choice. And sometimes natural is absolutely the wrong choice. So, FDA approved bioidenticals are still, in my opinion, the safest and most reliable options. Compounded bioidenticals can be useful in certain cases, but require careful consideration and choice of pharmacy. And the route of administration matters, especially when it comes to oral versus transdermal versus vaginal estrogen preparations. All right. So if you found this episode helpful, please share it with someone who might benefit. And if you have questions about hormones or thyroid, please send them in to Dr. Gibbs at danagibbsmd.com. I will cover them in a future episode. I'm also now doing a weekly Q&A on the new Good Self app, which is an ad-free and free platform where health experts can connect with the public in an open forum type format. So come and follow me on Good Self and tune in on Tuesdays at 12:30 Central, where you can submit your questions for me to answer. All right, guys, thanks for listening, and I'll see you next week. Thank you for listening to this episode of Beyond the Thyroid. If you found this information valuable, it would mean so much to me if you'll take a few seconds and give the podcast a 5-star review. It helps other people who need this information find the show, and it's really easy. Just search and click on the name of the show, Beyond the Thyroid, and scroll to the bottom to ratings and reviews. I truly do read and appreciate every one. Remember, when it comes to hormones, there will always be more to discover. So follow the show so you get the next episode as soon as it's released. And if you or someone you care about needs a caring doctor to help figure out how to heal hormone problems that other doctors have dismissed, check out my website at www.danagibbsmd.com. And if you're not a physician, please keep in mind, while I'm a doctor, I'm not your doctor. The content of this podcast is my opinion, and it's for educational and entertainment purposes only. This is not meant to be individual medical advice, and you should consult your own physician for any medical issues or diagnoses that you may have. I look forward to continuing this journey with you beyond the thyroid.